Hi, my name is Hayleigh. In January 2013, I was diagnosed with Anti-NMDA Receptor Encephalitis. Before now, I didn't know anything about this condition, its causes, its symptoms, or the effects it has on its patients. Initially admitted to Hayleigh Hospital in December 2012, there was a lot of uncertainty. Not only did my mum and other family members, as well as friends, not know what was wrong with me, nurses and doctors found it hard to give me a diagnosis. It was only when my sister's boyfriend's sister, a trainee nurse on a high dependency unit at the time, mentioned to a colleague about my symptoms. He then suggested to her that I was tested for the encephalitis. Due to my symptoms of change in behaviour and my abnormal and involuntary movements, doctors and nurses at Hayleigh Hospital put these symptoms down to psychosis and wanted me to be tested by the psychiatric team. Obviously, once the encephalitis was mentioned, I was tested for that via a blood test and a lumbar punch, which was then repeated on my arrival at Charing Cross Hospital, as they hadn't had the results back from Hayleigh, and it was vital that I had a diagnosis so that treatment could start and so that my mum and other family and friends could have that little bit of ease and that little bit of tension and pressure taken off of them. With an initial misdiagnosis of epilepsy and a prolonged diagnosis, this all led to an 11-month-long stay in hospital where I underwent life-saving treatment and rehabilitation. As I was so unwell during the 11 months in hospital, I don't remember any of it, well, at least not from at least December 2012 up until October 2013. I have no recognition of any events or memories of anything. So I rely on my family and friends to tell me things. Some cases are still going undiagnosed due to the lack of knowledge and awareness. When I began my research looking into this particular encephalitis, I found very little documentation. So I'm hoping that with my story, I can reach out and raise awareness to people and possibly help cases similar to mine get treated sooner.
Hello, my name is Nicola. I'm Hayleigh's mum. She had her first seizure on the 18th of December 2012. For 3 days I was taking her to Hayleigh Hospital, which they diagnosed epilepsy, sent her home with Keppra. This continued, didn't get any better. On the 3rd day of taking Hayleigh to hospital, she was finally admitted to Hayleigh, who run further tests the following morning via a lumbar punch. Within 3 days, Hayleigh couldn't talk, walk, eat, drink. There was no response from Hayleigh. She was in Hayleigh Hospital for 13 days whilst waiting in bed for a neurology section at Charing Cross Hospital. Finally, she was transferred over there on the 2nd of January 2013. Results still wasn't back from Hayleigh Hospital, so a further lumbar punch was repeated. When Hayleigh was first transferred over to Charing Cross from Hayleigh Hospital, she was assessed by various doctors. One of the doctors mentioned about a teratoma tumour due to NMDA, but until further results were back, nothing could be finalised. Hence, no treatment really could start until they knew for certain. Within less than 48 hours of Hayleigh being admitted into Charing Cross, she was taken into the intensive care unit as her airways gave up. This was a very emotional time, and still we didn't know or have a diagnosis for Hayleigh for a following 2 weeks, when we finally got the diagnosis of NMDA, autoimmune encephalitis. Hayleigh had to have various treatments, I think due to the diagnosis taking so long and treatment didn't start immediately. When Hayleigh was actually first transferred to Putney Rehabilitation, she was unable to do a lot of things. Walk, she had just started learning how to talk again.
3, 4, 5, 6, 7.
Hayleigh done very, very well, and I'm very proud of Hayleigh. It was very, very hard to see my daughter suffer like this. No one should be undiagnosed with this condition.
NMDA is a condition due to it's called autoimmune encephalitis. Means your body immune system reacted to a trigger and then start to attack your own sort of your brain, causing the encephalitis. So it's not actually due to a virus. I've been Hayleigh's neurologist since she first presented towards the end of 2012. That's when she was brought to Hayleigh emergency department, and then she had quite a long stay at Hayleigh and subsequently at Charing Cross Hospital, including at the intensive care unit when she was quite unwell, but thankfully she made a very, very good recovery. I mean, for NMDA receptor encephalitis, the initial symptoms can be quite non-specific. They can present with almost like a cold or flu-like symptoms like mild headache, runny nose, sore throat. This then can progress to seizures, confusions, involuntary movements, sometimes become comatose. And then during the severe stage, patient can also have severe heart rate and blood pressure fluctuations as a result of involvement of the nerve called autonomic nerves. So when patients present with symptoms of encephalitis, of which there are several causes, can be virus, autoimmune, and NMDA receptor encephalitis, one of the autoimmune, we usually would do a brain scan, usually an MRI brain, to look for any signs of inflammation. Often we'll do some blood tests, and we'll do a lumbar puncture, which is to get some spinal fluid out of the spinal column to test for any evidence of inflammation. We often would do a brain wave recording called EEG. The test that confirms the diagnosis is usually a blood test, which confirms the presence of the NMDA receptor antibody. But the blood test can take a few weeks to come back, so we often rely on other clues like clinical findings, brain scan, and EEG recordings. In many patients with NMDA receptor encephalitis, we often find a growth in the ovary called ovarian teratoma, which can set off this abnormal immune reaction. In Hayleigh's case, we didn't find the ovarian growth, so she's still requiring 6 to 12 monthly scan of a pelvis and blood test to check that the antibodies have not increased in level and that she remains well, and hence she needs to be under regular surveillance for that. Once diagnosed, because this is autoimmune encephalitis, meaning your immune system becomes either overactive or becomes slightly sort of haywire, try to attack your own brain. So we need to suppress or control the immune system. So the medication we treat are usually things that control or suppress the immune system, including steroids, something called immunoglobulins, or plasma exchange to filter off the abnormal antibodies in the plasma. Or in some patients where these measures are not helpful, we may give stronger immune suppressing medication intravenously.
Hi, I'm Laura, I'm Hayleigh's twin sister. I was living with Hayleigh in 2012 when she first started showing signs of her illness. I didn't really know what to think. It was more, she was very stressed all of the time. I'd come home and she would be stressed, and just something wasn't right in Hayleigh. My sister and I drove Hayleigh to her uni to pick up some work that she needed, and we was driving the car and we went into a car park, and she just got out the car. She just opened the car door and just got out of the car, and my sister was just screamed sort of at her and was like, "Hayleigh, get back in the car." And she got back in the car and we was like, "Hayleigh, what is wrong?" And she was like, "What do you mean?" And we was like, "You've just got out of the car." And she was like, "No, I didn't." And that's when I started to panic. I was like, oh my gosh. And the whole way home she kept looking at me in the mirror, but just looking at me blankly. And I'd say, you know, "What are you looking at?" And she just wouldn't reply to me. I believe it was either that night or the following night that I called my auntie because I was seriously worried about my sister. And she said that she may be having a mental breakdown, which I didn't believe was right. Hayleigh had no reason to have a mental breakdown, to be honest. We then called 111. My mum was currently living with us at this time. They made us an emergency hospital appointment. We took Hayleigh straight to hospital. They gave her seizure tablets, I believe it was. They said that she had epilepsy. We took her back home, and I just found it weird that all of a sudden at that age she would be diagnosed with epilepsy, and I didn't want to agree that that was the problem. So she took the tablets, but then we started seeing her have fits herself. And again, I just wasn't happy. I just wasn't happy with what they were saying. I just felt there was something more to this. So we then took her to the hospital again. I think it was about 2 days after. And that was it. That day we took her back in, she was admitted.
Hi, my name is Aisha. I'm Hayleigh's long-term friend of 20 years. I think I first found out about Hayleigh's illness from Laura, her sister. That was the time she was in Hillingdon Hospital. I didn't get to visit Hayleigh in Hillingdon, but I did first visit her when she went to Charing Cross. The day I went there, I didn't know what the hell to expect. I was scared, I was worried, I was anxious. Oh God.
I suppose it's a little bit more hard because you can't talk to her as well.
Yeah, sorry. I remember getting to the hospital and like Laura was waiting outside in a waiting room for me. And we got into the room and I couldn't even I saw Hayleigh and I couldn't even look at her for long. I looked at this person in the bed and I thought, that isn't Hayleigh. I didn't recognise her. She looked so different. By this time she was already in the coma. And she just looked lifeless, and I think I just had to walk out of the room. I remember just
It's not Hayleigh, is it? Lifeless. She's the most energetic one out of all of us.
Definitely.
Yeah, the loudest. To see her not being able to do anything for herself, and nothing that we could
just
do to help her.
Yeah.
We couldn't help her. You'd ask the doctors what could we do, but there was just nothing we could as friends or family to do for her.
No, it was difficult. It was a difficult time.
Personally, out of all people that saw Hayleigh, I do think Aisha seemed to struggle the most. I'm not sure why. I think it could be because she didn't watch Hayleigh's her getting into hospital. She didn't watch her slowly get ill. You just all of a sudden you saw Hayleigh probably at home and you was having a laugh and a drink and a dance.
Yeah,
as
that's
always.
Literally what it was.
And then all of a sudden she's in this hospital bed with tubes all over her and just literally helpless.
Now concentrate on what you're doing.